Vertigo does not always come from the ears. For middle-aged and elderly patients with risk factors such as hypertension, dyslipidemia also called hyperlipidemia and diabetes, vertigo from the brain, or central vertigo, is important. So what are the diseases of central vertigo? This is central vertigo Part 1. Many people may think that central vertigo is only associated with cerebral hemorrhage or stroke, but this is not true. There are many other disorders. 1. One of the most common diseases is vertebrobasilar insufficiency. VBI. This may sound strange to the general public, but even physicians do not always fully understand the name of this disease. Hemodynamic type, or HVBI, is the most common type seen in daily clinical practice. Therefore, it differs from the diagnostic criteria for VBI in the United States. According to the U.S. diagnostic criteria, vertigo alone should not be given this diagnosis. However, at least in Japan, the name of this disease is gradually being used, because if we persist on this, we will not be able to find an appropriate diagnosis in reality. In simple terms, it is a temporary poor blood circulation in the brain. It is already known that the vestibular nucleus in the brainstem is vulnerable to oxygen deficiency and is prone to poor circulation before the inner ear. For this reason, it is unlikely to be accompanied by hearing loss, tinnitus, or other ear symptoms, but only dizziness, including vertigo, which is often rotatory. However, hydrops, edema, of the inner ear can also occur in this disease, so it may be associated with ear symptoms similar to Meniere's disease. Although it is not very common. The duration of the vertigo is often short, around a few minutes, but sometimes it can last from a few hours to several days. Because the nystagmus is directionally fixed, unidirectional, either to the right or to the left, the disease is often diagnosed as peripheral vestibular neuritis. In daily practice, vertigo and wobbly dizziness, spinning sensation, in middle-aged and elderly people are often caused by this disease. I hope you can understand that dizziness or vertigo is not only in the ears. Unless a high-quality MR system comes on the market in the future, it is also important to note that current MR apparatus do not usually show any abnormalities when examining the brain on this disease. So, please do not misunderstand that no abnormality in the current MRI of the brain does not mean your vertigo is no problem. 2. The next most common type of vertigo in middle-aged and older patients is central paroxysmal positional vertigo, which is caused by the brain, and will be discussed in detail later. The following is central vertigo Part 2. 3. Malignant paroxysmal positional vertigo. It is a type of vertigo that occurs when changing head position, mainly due to a tumor or vascular disorder in the brain, hemorrhage or infarction, around the fourth ventricle, which is located between the brainstem and the cerebellum. Moreover, this vertigo is life-threatening. 4. Cerebellar hemorrhage, infarction, tumor, inflammation. 5. Hemorrhage, infarction, tumor, or inflammation of the brainstem. It is called brainstem encephalitis. 6. Acoustic nerve tumor, a benign tumor arising from the vestibular nerve. Tumors arising from the auditory nerve itself are rare. The most common symptoms are unilateral tinnitus, progressive hearing loss, and unsteadiness of the body rather than vertigo. 7. Subarachnoid hemorrhage. Vertigo occurs in about 4% of cases. In my past experience, a male in his 40s had recurrent severe vertigo every month for 5 months prior to his subarachnoid hemorrhage. When you have frequent episodes of severe vertigo, you should not assume that you have Meniere's disease or benign paroxysmal positional vertigo. Although it is rare, it can be a sign of cerebral infarction or cerebral hemorrhage, so you should have your brain checked by MRI and MRA. What is the vertebrobasilar artery? The assumption that 90% of vertigo is caused by the ears is a serious misconception. Therefore, I would like to explain more details about central vertigo. Vertigo from the brain. First, let's talk about the vertebral artery and basilar artery. There are two systems of arteries that supply blood to the brain: the carotid artery system in the front of the neck and the vertebrobasilar artery system in the back. It is the vertebrobasilar artery system that is associated with vertigo. The right and left vertebral arteries flow upward through the cervical vertebrae toward the brain, as shown in the figure. After entering the skull, the posterior inferior cerebellar artery first branches off to the left and right, and then flows upward to join a single basilar artery. After merging, the anterior inferior cerebellar artery branches off to the right and left. This artery goes to the tip and sends blood to the right and left inner ear. Further up, the superior cerebellar artery branches off to the right and left. What I would like to focus on here is that among these vertebral arteries and the basilar artery, there are 3 locations that are prone to atherosclerosis. It has already been determined that these 3 locations are prone to blood flow disorders due to arteriosclerosis. The starting point. Origin of the vertebral artery, where the vertebral artery branches off from the subclavian artery. The location just before the bifurcation where the posterior inferior cerebellar artery branches off after entering the skull. And the area just before the confluence of both vertebral arteries with the basilar artery. 1. About vertebrobasilar insufficiency. The name of this disease may sound difficult at first glance, but let's talk in detail about the circulatory insufficiency of the vertebrobasilar artery that I mentioned earlier. This disease is characterized by nystagmus in a fixed direction, either to the right or to the left. In middle-aged and elderly people, diabetes, dyslipidemia, and hypertension tend to be the base of the disease. Arteriosclerosis becomes especially important. When the vertebral arteries suffer from arteriosclerosis, the blood vessels become long and stretched like an old rubber band. Since the height of the neck is fixed, the blood vessels will naturally bend and meander. Therefore, even without opening the arteries and looking at them, if there is any bending or tortuosity, the presence of arteriosclerosis can be found. Furthermore, since 50% of people are born with a difference in the thickness of their vertebral arteries from left to right, this in itself is not uncommon. However, when arteriosclerosis is added to this, the originally thin vertebral artery becomes thinner and thinner, affecting blood flow. In other words, there is a difference in blood flow velocity between the left and right vertebral arteries. As a result, turbulent flow occurs after merging into the basilar artery. This has already been proven in a model experiment by Professor Matsunaga et al. Of the Department of Otolaryngology, Nara Medical University. This fact is not easily recognized even among doctors. When turbulence occurs in the basilar arteries, hypoperfusion, stagnant blood flow in the basilar arteries becomes chronic, and subtle ischemia in the brainstem is always latent. Since it is only potential, it does not lead to vertigo at this level. When additional factors are added to the potential and they overlap 2 or 3, vertigo can occur. Then what are these additional factors? They are the stiff neck and shoulders that become stronger than before, turning the neck in circles several times, or increased mental and physical stress. Nowadays, even if arteries are not narrowed or obstructed according to simple MRA or MRA with contrast agents, mental or physical stress alone can cause the adrenal glands to increase stress hormones such as adrenaline, noradrenaline and cortisol in the blood, causing arteries to tighten and platelets to become activated. It has already been proven in the US that stress hormones causing arteries to tighten and platelets to become activated, resulting in stagnant blood flow and poor circulation. However, this important fact of poor circulation caused by stress is still not acknowledged by majority of medical institutions in Japan. This phenomenon of blood flow returning to normal after vertigo subsides has been proven by the Department of Radiology at Nara Medical University using echography. At present, many medical institutions are also still not aware of this fact.